So now I'm going to quickly move on. I just want everyone to have some high-level recommendations from our practical guide that we published last year. And again, this is through the Alliance for Health Policy and Systems Research, which is part of the WHO. So in terms of performing rapid reviews, so this was a fantastic chapter in the guide that was led by my colleague Valerie King. So when we're doing rapid reviews, we have found that early and continuing engagement with the requester is actually essential. It helps to focus the rapid review, and it actually makes it a lot more relevant and makes sure that the methods that we use will fulfill the needs of our knowledge users. Methods can actually be tailored across the entire review process. And so we don't have a standardized set of methods for conducting rapid reviews or a definition for rapid reviews. And also want to point out that the consequences of the different choices that we make at this point in time are quite uncertain. So it is something that you have to tread carefully and be very, very thoughtful in your approach when you're tailoring your methods according to your knowledge user needs. Researchers need to make transparent choices. It has to be informed by your knowledge users, and we want to make sure that this evidence that we put forth, it's fit for purpose. So we want to make sure it's very relevant and it makes sense, and those methodological choices that we make, it really is going to fit that purpose of that end product or that decision that your knowledge users need to make. So you have to be very thoughtful when you're doing a rapid review. And as I mentioned, we do have information technology. So some examples here, I'm not going to go into all of them, but we do have open meta, we have abstractor, we have covenants, etc. So there is quite a lot of automation software packages that are out there. If everyone is aware of the SR Toolbox, so if you go into Google and you write in SR Toolbox, you're going to see an online database of over 100 different tools for automation. So they are out there, they do exist. However, the research on the reliability and validity of these methods are in its infancy. Some of them do have that information, but not all of these packages have that. So moving on quickly to chapter 3. So this was looking at when we're selecting, abstracting, and appraising studies in rapid reviews, how do we make sure that we improve the quality and efficiency in these steps? So content experts as well as experienced reviewers can increase the review rigor as well as expedite the review process. So if you have a systematic review team and now you guys decide you're going to start doing rapid reviews for your knowledge users, it actually is quite an easy transition, because you are all going to know the methods. You're going to hit the ground running. You're going to have standardized approaches, and you might probably already have content experts. So for the different topics, you can ask them. These content experts are great because they could say, you know what, there really wasn't much literature on this in 15 years. You can truncate your lit search. They could say, these are some of the terms that we want to look for. They just can let you hit the ground running so that you can get those results really, really fast. So if you include content experts as well as experienced reviewers, this is actually going to enhance the rapid review process. And if you use well-defined eligibility criteria, pilot testing, so in the Cochrane Handbook, they do talk about pilot testing. So at each stage, you use explanation and elaboration forms. So for screening, for data abstraction, for that risk of bias or methodological quality appraisal. And if you do training and calibration, this actually takes a bit of time at the start, but in the end, it does improve not only the quality of your rapid review, but the efficiency. So it does make sense to take that time and to do that pilot testing and calibration at the beginning. Engaging authors. So you can consult. Again, this is something where it does take time to email authors for additional information. But if they get back to you really quickly, and if you give them a timeline and a deadline, respond to me by Friday, then it will increase the quality and efficiency of your rapid review. So again, this is one of those things where you have to balance carefully, because it does take time to email those authors. but there is some empirical work out there suggesting that this can actually increase the efficiency as well as your process. And then I'm just going to touch on one last chapter and then open it up because there's a lot of questions here. So really excited to see everyone's interest. Keep those questions coming in. So we also, this is led by my colleague, Sandy Oliver, who's with the EPI Center in the UK. So fantastic chapter again, where she was looking at how do you select the methods, especially when we're working with complex questions in health policy and system improvements. So sometimes this two-stage process really helps, and we do this quite a bit. So we scope the literature and we go back and forth. It's kind of very iterative at the start with our knowledge users, right? So we're scoping them, we're kind of mapping things out, and then we may have to refine or narrow the question and say, you know what, excuse me, if we expand our PICO's criteria, you know, we're going to have to screen 20,000 titles and abstracts. We just don't have the time. So can we limit it in this way, right? So it's kind of this two-step where you start with this refining, iterative process where you do the scoping, and then, you know, with the stage two, after you refined your question, then you can actually go through towards the synthesis. So this can help, excuse me, especially if you have quite considerable time constraints. Excuse me. Another thing is transdisciplinary collaboration. So when we think about this, faster reviews. So if you want to do it really quick, you're going to have fewer stakeholders or knowledge users. You're going to have less discussion. You're going to have less iteration. And you're going to really focus on perhaps systematic reviews that have already been done, for example. So past accumulative work, right? So already looking at previous synthesis, maybe updating something quickly. But when you have more knowledge users and more discussions, more iterations, then you know, it could lead to a richer rapid review product for your knowledge users. So again, we have to balance this so carefully and think through and be very thoughtful in our approach, and very thoughtful with engaging our knowledge users and making sure that the engagement is sufficient for their needs, but then also will help move your rapid review along quickly. So some things to keep in mind here. So if you have a very focused questions and sub-questions and static thematic framework, so in particular when you're doing qualitative evidence synthesis, if you already have a framework in your mind at the very beginning, that's actually going to be faster, and that's actually a less sophisticated synthesis. However, if you have more of an evolving framework and you're allowing that framework to evolve based on the studies that you have found and have included, you know, and also with your discussions between the team and the stakeholders, this is a lot more slower, it's more sophisticated, it's more fun, it's more collaborative, but it takes more time. And maybe you won't be able to make that 3-month time frame. So sometimes more, and particularly when we're thinking about qualitative evidence synthesis, it can be quite tricky to apply a rapid review within that realm. And so you have, again, it's all about being very thoughtful about what are their needs of your knowledge users, what can we do to tailor our methods, and you know what makes the most sense. If they're looking at a question about the patient's lived experiences, then a qualitative evidence synthesis is absolutely relevant to them. And you know, are you going to do a static thematic framework where it's going to go really fast, or we'll use this evolving framework, which is going to take more time, but again, more sophisticated and potentially more relevant and more rich findings potentially. So again, some rapid reviews use prior systematic reviews. So they could either do a reanalysis, they could either do a review of reviews, or they could do an update. So this again may reduce time. So if you're a rapid review center just starting out, then these are some different techniques that you can think of using to provide your knowledge users with some information for their decision-making needs. So just quickly before I open it up, we have about 10 minutes for more questions, and I just want to acknowledge all the generous funding that I have been very fortunate to receive here in Canada, as well as our fantastic research team that make me look amazing on a daily basis. Huge shout out to Jasmine, Wasifa, Susan, and Shazia, as well as co-investigators on our research program that are all listed here, including my mentors, Dr. Sharon Strauss, as well as David Moore. And I'm going to go through some questions now. Please follow me on Twitter, as well as if I can't get through all your questions today, please feel free to email them to me anytime. Here's my email address. I'll leave this up, but want to thank all of you for being such a fantastic audience and for all of these amazing questions so far.